Hi, Corner Crew. It is Christina and Cindy with Adaptive Equipment and Caregiving Corner, and it's time for another episode of
Rolling with Ruby.
Rolling with Ruby. That's right. I think this is probably our 11th episode, Sin.
That sounds like it. That sounds right.
11 or 12.
Yeah.
I guess you just lose track after a while, huh?
You just lose track.
Well, we are happy to have you on this journey with us today. Today we're going to be talking about concerns that a caregiver needs to be aware of if they are caring for a loved one that has the inability to reposition themselves in bed, in a chair.
Mm-hmm.
So kind of talking about, skin integrity and
right.
bony prominences and pressure points. And
because we all, if you think about it, Christina, we all move all the time. We don't really recognize it because it's so natural. We're able to move. And
the second you get uncomfortable or you feel a pressure in a certain area, you're able to shift around, and you're right, we don't notice it.
That's right.
Yeah.
But we're talking about those people that are pretty much dependent with care or positioning, and those are the people that we really got to watch. For skin issues, and which can lead to a lot of other things as well.
Absolutely. So before we jump into it, we just want to remind you that Cindy is a physical therapist. I'm a speech language pathologist. We founded Adaptive Equipment and Caregiving Corner. You can find us on YouTube. You can find us on all your usual suspects for social media, like Facebook and LinkedIn and Instagram, and we are even on TikTok.
Yes, we are.
So,
and they can find us at aecorner.com.
And we also have a website, so you can find us at aecorner.com. So, if you find this video valuable or any of the content that we put out valuable, then we would appreciate if you would like and follow and subscribe, especially on our YouTube channel. We just rolled over, Sin.
Yes, 15,000.
15,000 subscribers on our YouTube channel. And you know what? That has been a long time coming.
Yes.
Cindy and I have been making videos since 2015.
Yes.
And so every subscriber, every follow, every like, share, that's all been organic.
Yes, and subscribing is free. Sometimes people don't understand that. It is
You're
free.
Right. It is.
Yeah,
it is free. But we've been working hard at this since 2015. We started it as a business in 2018. And so where we are at today as far as likes and followers and subscribers is because of you guys finding value in our content, and we really appreciate that. The 15,000 subscribers on YouTube, it is an honor and a blessing to be able to get to come to you guys and do this and share what we've learned in our careers.
Right.
So let's go ahead and get started. So we're talking about 5 areas or 5 concerns that a family caregiver may have about if they're caring for a loved one that has the inability to be able to reposition themselves in bed or in a wheelchair or anything like that. So the very first concern, the first area, I guess, would be skin breakdown.
Right.
Skin breakdown or skin integrity.
Yes.
And why would that be?
Well, if you think about it, just for example, I mean, even if you just take your finger and press down on your hand, and hold that for a few seconds, when you lift that finger up, you're going to see your skin is kind of white.
Yeah, it's kind of blanched.
Yes, but then it starts to get red again, right?
Yeah.
So when we're putting pressure on that, we're reducing the blood flow to that area. Our blood brings oxygen and nutrients and takes away waste. And if that pressure is sustained too long, then the skin and the tissues start to break down. So because they're losing their oxygen, nutrients, all that good
circulation
stuff. That's exactly right.
Gotcha.
So that is what we start getting concerned about. If someone is laying or sitting in one position for too long, those areas that are prone to that breakdown. So we're going to talk about that, but we're talking about, again, we said we reposition ourselves all the time. But an individual that can't, we need to be paying attention to that and checking and really repositioning every 2 hours. If they're not moving at all, in whatever their bed or chair or whatever they're in.
So let's kind of touch on. We had talked in the opening. We talked about bony prominences.
Yes.
Tell me what that means.
So bony prominences are any area that you have a bone that is close to the surface of the skin.
Gotcha.
So kind of at the sides of your elbows.
Yeah.
We have the bones at the sides of our ankles that kill us whenever we accidentally hit the bedpost or something like that, right?
Yep.
The insides of the knees can be an issue.
Heels.
The heels are a huge issue if someone's laying on their back and the heels are pressed on the bed.
Yeah.
The tailbone can be an issue when you're sitting too long if you're not repositioning, and sometimes the sit bones, depending on how much, they're little rump bones.
Yep.
Depending on how much padding you have down there.
Right.
Now, sometimes people, if they're really thin, can even have pressure areas along their spine, the little bones that stick out on the back of their spine, their shoulder blades. If they're on their side, you can get it here at the shoulders. There's all kinds of places that you have to kind of just keep an eye on, especially again where you have those bony prominences where the bones are very close to the skin.
Okay. So now we've got these bony prominences. We have a loved one that cannot reposition themselves.
Right.
What are some things that somebody might be able to do, a caregiver might need to do, to kind of decrease that risk of skin issues in those bony prominent areas?
Right.
What could a family caregiver do to help decrease that risk?
Right. So one of the things, the first thing is what we're talking about, or one of the things is the repositioning, making sure that we're repositioning every 2 hours.
Okay.
The other thing is padding. Padding with towel rolls or pillows or things like that.
Things like a pillow from around the house. It doesn't have to be any special.
It doesn't have to be special.
Kind of wedge or anything like that.
Right. Now, if you have somebody that's sitting in a chair and has a tendency to have some breakdown on their tailbones, something like that, you may want to look into a seat cushion. And depending on the person and the pressure, some of those can be prescribed. They can do what they call pressure mapping, especially if somebody's sitting in a wheelchair for a long period of time.
And where would somebody find that out? Where could you get pressure mapping?
You can do that. So any company, any medical supply company that specializes in special chairs or the wheelchairs, things like that. A lot of individuals that may have a spinal cord injury. Those types of cushions are very important. Some are air filled. Some have memory foam and different layers of gels and things like that. But that's very important for sitting. For people laying down, especially on your side, thinking about, trying to protect the inside of the knees and the inside of the ankles, you can put a pillow between their knees. You can, if they're laying on their back, you want to make sure those heels are up off of the bed. You don't want your heels laying flat on the bed because they're very prone to break down. So you just take, you can take a small towel roll, something like that, just to get the heels up off the bed.
Off the bed, okay.
Sometimes in a chair, I've padded people's elbows, like at the end of their elbows.
Oh, where they rest on the armrest.
Where they rest on the armrest can sometimes do that. So I've rolled up little towels and positioned that at the forearm so that area is floating, basically, and not touching a surface.
Okay. If you're just joining us, it's Christina and Cindy with Adaptive Equipment and Caregiving Corner. Cindy's a physical therapist. I'm a speech-language pathologist. We are the founders of Adaptive Equipment and Caregiving Corner, and today on Rolling with Ruby, we are talking about 5 concerns that a family caregiver might have regarding a loved one that might have the inability to reposition themselves in bed or in a wheelchair. And so we are on topic number 2, or concern number 2, which is pain, which is obvious, you would think.
So that's what happens whenever your skin starts to break down and there's a lack of oxygen and nutrients. That's when you start feeling the pain.
Right. And now some of our loved ones, let's say maybe we're caring for a loved one that might have advanced dementia.
Right.
And they don't have that ability to let you know, using their words, that they're having pain in certain areas.
Right.
and they need to be repositioned. Sometimes you'll see behaviors,
Right.
you know, and that would be one of the areas that you would want to check and make sure that they are not in pain, because that's when you'll start seeing behaviors. But most of the time, if the person is, able to communicate with their family caregiver that they are in pain, then you would need to address the pain.
Right, and when I say the skin breakdown, it may not even be happening. They may be experiencing the pain just because they've been in that position and there's pressure being applied too long. And that doesn't necessarily mean, oh, you've automatically got skin breakdown.
Right.
But you need to pay attention to that too, because they may still have that sensation of pain, but they can't move to get out of it.
Yeah.
Yeah,
I mean, if there's lack of blood, oxygenated blood getting to that area, you're still you're gonna feel pain.
Yeah.
I mean, and so when we start to feel discomfort, I guess, that's when we would shift around in our, in our chair, or if we're laying in bed, then, but if,
and it just kind of, it all depends too, again, on the diagnosis. If you have somebody that, has lost feeling, maybe they have some, if they've got neuropathy, if they've got different things lost, if they're not able to necessarily feel that, they may not. But for sure, we need to pay attention to anything that may indicate they're in pain.
Okay. All right. Very good. So this is Christina and Cindy with Adaptive Equipment and Caregiving Corner. We are talking about the top 5 concerns that family caregivers need to be aware of if they are caring for a loved one who has the inability to reposition themselves in bed or in a chair. We are on concern number 3, and that is sin infection. So infection, now we're talking about skin breakdown.
Yes.
Okay.
Yes. And then once that's open, once the skin is open, then there's always that being prone to infection, especially when it gets to, if you have breakdown on the tailbone area, in the sit bone areas, and then you have issues if your loved one is incontinent. That kind of all can compile, in that it makes them more prone to infection. Yeah,
and it's just especially in the tailbone area, it tends to be, it locks in some of that body heat and the moisture.
Right. And then, then you have the combination of some, if they're incontinent of urine and bowel, then that really increases the risks for infection.
So, tell me. So let's talk about. So we're talking about infection. So let's kind of back up a little bit and talk about what do we need to do to be able to not get to that point, have our loved one get to that point. So what are some things we need to look for when we're repositioning? Okay, so we know our loved one has a lot of bony prominences. Maybe our loved one is thin, or maybe they're just from laying in one position, like their heels, for example. What do we look for to keep it from advancing to the point where we have skin breakdown and then we run the risk of getting an infection? Right.
So when you are repositioning, or we often tell caregivers, especially if the person is dependent, they're going to be dependent in activities of daily living, most likely. So if you're helping change them or dress them or something like that, you always want to kind of be looking through these different areas. Especially if they're if you're changing an undergarment. You want to continuously check these areas. So you don't want to see any of that blanching, like that whiteness, like when you pressed on your skin.
And that's what it's called, blanching.
Yes, blanching. And then if you start to see some dark red areas that are not going away, they might start, as they advance, you might start seeing some purplish, coloration.
Like a bruise?
It's kind of that dark color. Red, dark red, and then that purple that's not going away, and then it kind of can turn worse to, get a black-looking color, and that's necrotic or dying tissue, basically.
So then when we're repositioning, that's a really good time to kind of give them the once-over, their skin the once-over, and make sure those areas. So if you're repositioning them, what's a good time frame to reposition your loved one? How frequently?
I
know it varies from person to person, but
I think it's typical.
Rule of thumb.
At least every, I would say 2 hours. Sometimes people can go longer, but I like the every 2 hours. You know,
Okay.
I think about me sitting in
Right.
one place very still for 2 hours.
Yeah.
I'm gonna want to move before then, probably.
Yeah.
But trying to do that and give those areas, you know, some relief.
Yeah.
And
Okay. All right. Very good. All right. So this is Christina and Cindy. We are with Adaptive Equipment and Caregiving Corner. If you're just now joining us, we've been talking about the top 5 concerns family caregivers need to know about if they are caring for a loved one who is immobile or has the inability to move themselves or reposition themselves in bed or in a wheelchair. And we are on number 4, Sin, already.
Mhm.
So number 4 is contractures. This is an interesting one.
Yeah.
I mean, that's like a whole
thing.
It is. It's
It
like
is.
a whole. I mean, like as far as therapy is concerned,
Right.
you know, physical therapy, occupational therapy. You guys address contractures as a part, almost like a sub-specialty within your practices.
Yeah. So a contracture is basically when a muscle shortens up,
Okay.
and you know, you know, the word I use the word kind of sets up because sometimes it feels that way.
Yeah.
But the muscle basically shortens,
Mhm.
and then you lose some range of motion in that joint. So, for example, usually when we lay in bed on our backs, our feet tend to kind of flop down.
Yeah.
Okay?
Yeah.
If someone is not able to move and reposition, you think about the heaviness of the covers,
Yeah.
you know, and that adds to that weight. If you stay in that position for a long period of time and you're not an active individual, you can't actively move out of that position,
Mm-hmm.
then the calf muscle, in that instance, starts to shorten.
Oh.
So then you lose that upward motion of the foot.
Yeah.
You know, and that's sometimes called a plantar flexion contracture.
Oh,
So
wow.
because your calf basically shortens up and you lose that range.
Yeah.
That can happen across the back of the knees is very common.
Yeah.
So the knees can, if you are bent in a position, a lot of times if people spend the majority of their time in a wheelchair and don't have active movement and can't stretch those hamstrings out in the back of their legs, or if they're in bed and they tend to kind of curl up a little bit, that can happen across the back of the knees, and then you cannot get the knees straight or the legs straight.
So like they're constantly in a 90-degree angle, like they're sitting in a chair.
Yes.
Okay.
You know, sometimes depending on the diagnosis, if you have a little bit of increased tone in your muscles, so they kind of stay more active, you can get that in your arm, across the elbow, you can get it across the wrist and the fingers and the hands. It just kind of depends on the diagnosis. So, you know, that's especially when you have an individual that is dependent with care, passive range of motion. You actually assisting in motioning those joints through their full range to try to stretch and prevent those contractions.
So passive range of motion. We call it PROMs.
Yes.
PROMs, like you're going to the prom, but it stands for passive range of motion.
Mm-hmm.
So if you're wanting to know more about how to provide your loved one with passive range of motion and exercises, you can look that up online. I'm sure there are lots of videos that address.
Yeah, and we have those videos in our caregiver
resource library.
We sure do.
We had a woman one time in therapy. She was. This is just kind of give you an idea of contractures. Mm-hmm. She was a secretary the majority of her career, administrative assistant, I believe now is what we call it. And she had to wear heels her whole career when she was at work. Mm-hmm. And so when she was in the nursing home for rehabilitation, we of course put her in like tennis shoes because we're in therapy, right? We don't want her sliding around. It wouldn't be right to wear a high heel. And she couldn't put her foot down. She couldn't put her heel down because she was so used to wearing those high heels that she actually walked almost on that ball of her foot and her tippy toes, not tippy toes, but certainly the ball of her foot. Mm-hmm. When she was, when we were trying to get her to to mobilize on a walker and stuff.
Right.
So
Right.
we ended up having to go back and have her family bring a pair of like a smaller heel shoe, and then we put some kind of rough stuff on the bottom of the shoe,
Right.
of the sole, so that she was able to at least get a little bit more grip. But
Right.
isn't that interesting?
Yes. Yes.
I mean, that just goes to show
It's
you,
just- yeah.
over time,
Yep. Yep.
your
I mean,
body makes those accommodations.
Right. And if you think just in general about people in general, let's talk about the hamstrings.
Yeah.
People's hamstrings are tight,
Yeah.
Yeah. And you think about someone that is not actively able to stretch their legs and use their legs. A lot of times too, you can get a contraction or contracture at the hip for sitting for a long period of time.
Yeah. So stretching's important.
Stretching is
And
hugely
that's really, if they
important.
can't, if your loved one can't stretch,
Right.
then the passive range of motion exercises, that's where that would come in.
Right. Right. To try to maintain what they have, and then it can get into some actual stretching if they're already in that position.
All right. So we are almost done here. We're almost through the fifth one. We're getting ready to do the fifth tip, or fifth concern. It's not even a tip, really. And so today we are talking about, this is Cindy, I'm Christina. We're Adaptive Equipment and Caregiving Corner. We're wrapping it up, and we are talking about the top 5 concerns that family caregivers need to know about if they're caring for a loved one that may have the inability to reposition themselves in bed or while sitting in a chair. And number 5 is discomfort, which again, a lot of these are obvious, but if you're caring for somebody that doesn't have the ability to communicate that with you, maybe at all or effectively, these are really good. These are really good tips to know. So number 5 we're going to talk about is discomfort.
Yeah, and again, that goes back to most likely the pressure areas that are not being relieved because they can't move on their own.
Yeah, so like the bony prominences.
Yep, the bony prominences again. And, here's the thing, too, if you think about it, people get stiff just sitting and, and sitting in the same position or lying in the same position.
Yeah.
So, I can't even imagine, besides just the pressure areas, just the stiffness in general in the body and not moving. And so we do, again, need to be paying attention, especially if someone is not able to verbally communicate, what are you seeing? What are you seeing that might indicate that they are uncomfortable, they are in pain, they're having some type of issue?
Yeah.
But the repositioning, again, is trying to, reposition them every 2 hours, getting them in a different position.
Using pillows, towels, and washcloths.
Right,
yeah.
Right, to try to assist.
So what would be your advice then? So the family caregiver has these concerns, or one of these concerns comes up. What's the family caregiver's next step if they are concerned?
Well, I would always, if you have the individual, of course, in a facility, then raise that concern in the facility. If you have them at home, I would raise the concern with your doctor. And you can always, if there's been what we've called before a change in condition. Maybe your loved one is, seeming to be more uncomfortable, having some issues. You can always ask for a therapy evaluation in the home, even if it's just a one-time evaluation for some further education.
Right.
Whether it's education on passive range of motion, positioning, stretching, things like that. Always ask. It's not gonna, it's not gonna hurt to ask.
Absolutely, and use that term, change in condition.
Right.
Especially when it comes to in-home health.
Yes.
Care.
Yeah.
Raise that concern. Use that phrase.
Right.
To your family care provider.
Yep.
And just say, I have some concerns.
Right.
I feel like there's a change in condition. Or even if you have a home health company that has been servicing your loved one, then maybe reach out to them, and then maybe they could try to get the ball rolling on that as far as getting script from the doctor to say there's been a change in condition and we need to call therapy out there.
Right.
We need to call skilled nursing back
Yeah,
out.
it wouldn't hurt to have a nurse assessment, just to do a once over, make sure everything is looking okay, skin
Mhm.
integrity wise.
Yeah.
You know, that's the big thing.
Yeah,
That's the big
yeah.
thing.
Because here's the thing. It just popped in my head. I thought, you know what? If I'm a caregiver, if I'm a family caregiver, and I'm providing care for a loved one that doesn't have the ability to, let's say, reposition themselves in bed,
Mhm.
and they get a red area, or the skin integrity is questionable on a
Mhm.
bony prominence. Let's say
Mhm.
on a heel.
Mhm.
Now it's to that point where I can't use that position.
Mhm.
You know what I'm saying? It's almost like that particular position is going to be out of circulation for a while until I can get that area addressed on the back of their heel. Or I could float it,
Yeah.
but again, now we're talking about sticking a towel under there,
Yeah.
and it's a little bit different of a position and stuff. Maybe that's not comfortable. I mean, it could just be this whole, cyclical
Yeah.
thing. And if you could just reposition them every couple hours. Do a skin check when you're doing the repositioning, and try to stay ahead of the game.
Right.
If you get behind, then it's really. I guess that's my point.
Yeah,
If
getting
you get
behind.
behind, it's really hard to get back
Yeah.
out in front of it.
Yeah, and that's a good point, because we do want to be proactive
Yeah.
with the propping and the padding and all of that stuff. We want to be proactive to
Yeah.
avoid that kind of downhill
Yeah,
run.
because then you're going to have you might have to have a nurse or a physical therapist or occupational therapist come out to address wounds, because that's a whole subset in itself too. It's
Right.
people that
Right.
are wound care specialists
Mhm.
that can come out. But if we can keep it from getting to that point,
Right.
just that much better.
Right.
So,
Right.
all right,
Absolutely.
well, that's all we had for today with
Yep.
Adaptive Equipment and Caregiving Corner with Rolling with Ruby. We hope you found this helpful. We enjoy talking about this stuff. We'll put this out on our YouTube channel. What I usually do, Sin, is I will break it down into what I call knowledge nuggets. So
Mhm.
every one of the tips, I just kind of break it down into more digestible pieces. If you don't have the time to sit here and listen to the whole thing, we'll break it down and put those out on all our social media channels. So we appreciate you guys. We appreciate your time, taking your time with us and listening to us. And again, if you're on whatever social media channel you're on that consuming this content, if you give us a follow, a like, and a share it with your friends that might find it helpful, we'd appreciate that. And we will catch you in the next video.